Hi everyone, Shawnna Sue here from the Union County Health Department, and I have with me today my boss, Jen. We are the public information team for the Union County Health Department. Hi, Jen.
Hi, everybody. Hi,
We've been receiving a lot of questions here at the Union County Health Department, and we want to talk about those questions we've been receiving. So many questions about a contact of a contact and exposure circles. Questions like, if my friend's friend is sick, do I need to be concerned about that? So I have Jen with me here today so we can kind of talk through that a little bit. So Jen, how would you answer that question? If a friend of a friend is sick, do I need to be concerned?
Great question, Shawnna, and great question to everybody out there that's called or asked. We would have loved to have an epi today, but honestly, they have been on the phone pretty much nonstop over the last several days working with employees and employers that have had this question. So let's talk about this. We, in our circle, call these contacts of contacts. So what if I know someone who knows someone who had COVID-19? What does that mean for me? So I'm going to try to say this, Shawnna, is in the most relatable terms I can. So bear with me out there. This is not going to be an epi answer. This is going to be a communications.
But Jen, like you and I talk, right? I'm not an epi, right? You have to make things really basic for me. And I appreciate that. So if you could break it down as basic as you can, help me understand it.
All right, let's do that. So we're going to start with, so let's use your example. For example, Shawnna, if I may, I'll use you and your husband, for example. So folks at home, Shawnna and I work very closely together. Most days we're in an office right across from each other. So we're very close contacts to each other. So what if Shawna's husband became ill with COVID-19? Well, the process would be, we would identify her husband's close contacts. Okay, so obviously a close contact of Shawna's husband is Shawnna. So my coworker, Shawnna, is now a close contact of a person with COVID-19. She would be instructed by our staff to isolate she would be instructed to quarantine at home to make sure that we kind of slow that spread and try to keep it confined to her husband. But what does that mean for me? Because I am a very close contact of Shawnna. Would I have to be quarantined as well? And the answer to that, folks at home, is no. Right now, we look at circles. We draw circles around the ill person and we work outwards to see where the exposures may be. So we've heard this before in other circles, but we're going to start it here today. What if we use Kevin Bacon terms? Okay, so if we use Shawna's husband, I'm just going to call him Bob for folks at home. If we use Shawna's husband as Bob, he's our center of the circle, right? And so Kevin Bacon's degrees of separation, his first degree of separation, his closest contacts are going to be people like Shawnna, his wife. Those close contacts are instructed to quarantine. And what we mean by that, they stay home and they watch themselves for symptoms. They do this for about 14 days. We at the health department work with them. We monitor them as well. How are you feeling today, Shawnna? Everything looking good? And if at the end of that 14 days there's no symptoms, they're free to go back within the community. But what about me as Shawnna's coworker, as Shawnna's friend who works every day with Shawnna? Am I at risk since Shawna's husband is now ill? And I am what we call a second degree of Kevin Bacon separation here, 2 degrees away from the person who's ill. And so my risk is not really that much greater than anyone else in the community right now. Where this changes, movie plot twist here, if I'm watching a Kevin Bacon movie, would be, what if Shawnna Sue becomes sick? If Shawnna Sue becomes sick, then I likely am going to be her close contact. Now that's where I would start to quarantine because I have had close contact with Shawnna, possibly. Now if Shawnna was at home and she developed her symptoms, 10 to 12 days into her quarantine period, I haven't seen her, not a close contact. I'm still considered at low risk. So that's kind of how that works, folks at home. So the bottom line here is, if you're a friend of a friend who has someone that's sick, your risk is not that much greater than anyone else out there in the community. And this is all following some CDC guidelines that we're looking at. So I hope that kind of gives it a really super simple explanation for everybody out there. Continue to call, continue to ask questions. These are really, unique times that we all don't have the answers to always. So the more questions we ask, the better we can be informed. And as you know from us, information is power, right? It helps us to make the best choices for our families.
Wow, Jen, that really is great information, because I know sometimes the information out there gets convoluted and gets twisted. And like you said, these are new times. weird things are happening and we're trying to understand it. And I love what you said, knowledge is power. Keep asking those questions, because the more we work through it, the more it becomes common and it makes sense and we get to answer those questions.
And I think another important thing, one of the things that makes our community so great, and I know we're not alone here across the United States, but in our community, we really do a great job of looking out for one another. So even if you start as everybody gets back to work, and we likely will see potentially more people who become ill as we get back out, what we need to keep in mind is that compassion and kindness we practice every day. If my close contact, if my friend, my dear friend Shawnna Sue I work with every day, has to quarantine at home because her family member becomes ill, that's not the time to like just completely, disconnect from her totally. We want to stay virtually apart from her, physically spaced apart from her, but it's a great time to check in on her. See, what can I do to help? What can I do to support my neighbor, my coworker, my friend? Can I drop off a meal on your doorstep? Can I just call and chat with you? Because we all know, my husband's in the other room, so I'll talk quietly. It can be a challenge to be at home, even with your own spouse for an extended period of time. Hopefully he didn't hear that. But let's keep those communication lines open, especially if someone we know becomes either ill or becomes quarantined. That's so important right now. And we can do those things virtually and keep connected, keep our distance, stay healthy, stay safe, but still look after our friends, neighbors, and coworkers.
Thank you so much, Jen. This has been really helpful here. I really do appreciate it. So if for anybody out there, like Jen said, if you have any questions, please don't hesitate to reach out. And remember, information is power. Kindness is key. Thank you so much. Thanks, Jen.
Thanks.